Introduction. Hydrochlorothiazide is a diuretic, commonly known as a water pill, used to treat hypertension, high blood pressure, swelling, edema, caused by fluid buildup diabetes insipidus, a condition causing excessive thirst and urination. Renal tubular acidosis, a kidney disorder. To prevent kidney stones in people with high calcium levels in urine. Brand names include Hydrodiural, Esidrex, Microzide, Hydroceluric, and others. It is often combined with other blood pressure medications in a single pill to increase effectiveness. Available as a generic drug and is affordable. Discovered by Merck and Company and Ciba Specialty Chemicals, it has been available since 1959. It is listed on the World Health Organization's list of essential medicines. Mechanism of action. Hydrochlorothiazide is a thiazide diuretic. It works by inhibiting the reabsorption of sodium and chloride ions in the distal convoluted tubules of the kidneys. This causes increased urine volume, decreased blood volume, natriuresis, excretion of sodium. The result is a reduction in peripheral vascular resistance, the resistance to blood flow in the small blood vessels, which helps lower blood pressure. Side effects: electrolyte imbalances, hypokalemia, low blood potassium, hypomagnesemia, low magnesium, hyponatremia, low sodium, hypercalcemia, high calcium, hyperuricemia, high uric acid, leading to gout, hyperglycemia, high blood sugar, hyperlipidemia, high cholesterol and triglycerides. Other possible side effects: headache, nausea, or vomiting, photosensitivity, increased sensitivity to sunlight, weight gain, pancreatitis, inflammation of the pancreas, increased risk of non-melanoma skin cancer, such as basal cell carcinoma or squamous cell carcinoma, potential allergy risk in people with a history of sulfa drug allergies, though this risk is debated, lightheadedness when standing, orthostatic hypotension. Contraindications: allergy to sulfonamide drugs. Some people may experience an allergic reaction to hydrochlorothiazide if they are allergic to sulfonamide-based medications, though the evidence on this is unclear. Severe kidney dysfunction. People with poor kidney function should avoid using this drug unless prescribed by a healthcare professional. Pregnancy and breastfeeding. Use during pregnancy should be assessed by a doctor, as it may not be safe for the fetus. It is also important to consider the risks for breastfeeding mothers. Additional information: combination with other drugs. Hydrochlorothiazide is often combined in fixed-dose preparations with ACE inhibitors, such as lisinopril and olapril, angiotensin receptor blockers, ARBs, such as losartan, valsartan, beta blockers, such as bisoprolol and metoprolol, potassium-sparing diuretics, such as triamterene. These combinations increase its effectiveness while reducing side effects. Sport. Hydrochlorothiazide is prohibited by the World Anti-Doping Agency because it can mask the use of performance-enhancing drugs. Drug use as monotherapy or in combination monotherapy. Hydrochlorothiazide can be used alone to treat conditions such as hypertension, high blood pressure, edema, fluid retention, diabetes, insipidus, prevention of kidney stones in certain cases. In combination. Hydrochlorothiazide is often used in combination with other medications to improve effectiveness and reduce side effects. Common combinations include angiotensin-converting enzyme inhibitors, ACE inhibitors. Example: lisinopril plus hydrochlorothiazide. Angiotensin II receptor blockers, ARBs. Example: losartan plus hydrochlorothiazide. Calcium channel blockers. Example: amlodipine plus hydrochlorothiazide. Beta blockers. Example: bisoprolol plus hydrochlorothiazide. Potassium-sparing diuretics. Example: triamterene plus hydrochlorothiazide. Most suitable combination: generics, hydrochlorothiazide plus lisinopril, ACE inhibitor. Hydrochlorothiazide plus amlodipine, calcium channel blocker. Hydrochlorothiazide plus losartan, angiotensin II receptor blocker. Hydrochlorothiazide plus valsartan, angiotensin II receptor blocker. Hydrochlorothiazide plus triamterene, potassium-sparing diuretic. These combinations enhance blood pressure control and reduce the likelihood of side effects, such as potassium depletion. Most popular international brands containing this generic and manufacturer name: Microzide manufacturer, Pfizer country, USA, Esidrex manufacturer, Merck and Company country, USA. Hydrodiural. Manufacturer, Sanofi country, France. Hygroton manufacturer, Novartis country, Switzerland. Diuretic manufacturer, Bristol-Myers. Squibb country, USA. Adverse events: electrolyte imbalances, hypokalemia, low potassium, hypomagnesemia, low magnesium, hyponatremia, low sodium, hypercalcemia, high calcium, hyperuricemia, high uric acid, which may lead to gout, hyperglycemia, increased blood sugar levels, hyperlipidemia, increased cholesterol and triglycerides. Other side effects: photosensitivity, increased sensitivity to sunlight, weight gain, pancreatitis, inflammation of the pancreas, increased risk of non-melanoma skin cancer, such as basal cell carcinoma or squamous cell carcinoma. Specific to food or meal timing, hydrochlorothiazide can be taken with or without food. It is best taken in the morning to avoid frequent urination at night. Orthostatic hypotension, dizziness when standing up quickly due to reduced blood pressure, may occur. People with a history of sulfa allergies may experience an allergic reaction to hydrochlorothiazide, though this risk is rare. Drug interactions. Lithium. There is an increased risk of lithium toxicity when used with hydrochlorothiazide. Non-steroidal anti-inflammatory drugs, NSAIDs, NSAIDs such as ibuprofen, may reduce the effectiveness of hydrochlorothiazide by decreasing kidney function and fluid retention. Digoxin. Hydrochlorothiazide can increase the risk of digoxin toxicity, particularly when combined with low potassium levels, hypokalemia. Anti-diabetic medications. Hydrochlorothiazide may increase blood sugar levels, potentially reducing the effectiveness of anti-diabetic drugs. Corticosteroids. There is an increased risk of low potassium, hypokalemia, when used with corticosteroids. Angiotensin-converting enzyme, ACE, inhibitors. Combined use may enhance the blood pressure-lowering effects, but increases the risk of hyperkalemia, high potassium. Other diuretics. Combining with other diuretics increases the risk of dehydration, electrolyte imbalances, and kidney damage. Food interactions. High-salt diet. A diet high in salt can reduce the effectiveness of hydrochlorothiazide as the body retains sodium, counteracting the drug's action. Foods rich in potassium. Be cautious with potassium-rich foods, such as bananas, oranges, and tomatoes, if used with hydrochlorothiazide, as it can lead to potassium imbalances. Alcohol. Drinking alcohol can increase the blood pressure-lowering effects of hydrochlorothiazide, leading to excessive blood pressure reduction and dizziness. Licorice. Licorice can increase the risk of low potassium and high blood pressure when taken with hydrochlorothiazide. Pharmacology class: thiazide diuretic. Primary action. Hydrochlorothiazide primarily works by inhibiting sodium reabsorption in the distal convoluted tubule of the kidneys. This leads to increased urination, decreased sodium and fluid retention, and reduced blood pressure. Uses: hypertension, high blood pressure, edema, fluid retention, diabetes, insipidus, a condition leading to excessive urination, kidney stones prevention in certain cases, pharmacodynamics, blood pressure, reduction. Hydrochlorothiazide reduces blood pressure by promoting the excretion of sodium and water, thus reducing the volume of blood in the circulatory system. Diuresis, increased urine production. It leads to the loss of sodium, chloride, and water, which reduces fluid volume, helping in conditions like edema. Electrolyte imbalance. By increasing sodium excretion, it can cause hypokalemia, low potassium, and hypomagnesemia, low magnesium, leading to muscle cramps and weakness. Renal effects. Hydrochlorothiazide affects kidney function by inhibiting sodium chloride symporters in the distal convoluted tubule, resulting in more urine output. Pharmacokinetics. Absorption. Hydrochlorothiazide is well absorbed orally with a bioavailability of around 60 to 80%. Onset of action. It takes about 2 hours to start working after oral administration. Peak plasma concentration. Peak plasma concentration is achieved around 4 hours after oral dosing. Half-life. The half-life of hydrochlorothiazide is approximately 5 to 15 hours, depending on individual metabolism. Excretion. It is primarily excreted unchanged in the urine. The drug is not metabolized significantly by the liver. Duration of action. The diuretic effects of hydrochlorothiazide last for about 6 to 12 hours, with some effects continuing for up to 24 hours. Protein binding. Hydrochlorothiazide is highly protein-bound, about 40 to 70% in the blood. Maximum daily dose. The maximum daily dose for hydrochlorothiazide is typically 50 milligrams, depending on the condition being treated. For hypertension, the usual dose is 12.5 milligrams to 25 milligrams daily, but up to 50 milligrams may be used in severe cases. For edema, 50 milligrams is usually the starting dose, which can be gradually adjusted. Chemistry. Chemical formula: C7H8ClN304S2. Molar mass: 297.74 grams per mole. Melting point: hydrochlorothiazide has a melting point of approximately 265 degrees Celsius. Solubility: it is slightly soluble in water and freely soluble in organic solvents like ethanol and acetone. Bioavailability: the bioavailability of hydrochlorothiazide is around 60 to 80% when taken orally. Organic molecule class. Hydrochlorothiazide is a thiazide diuretic. It belongs to the thiazide class of medications, which primarily work by increasing urine production and reducing fluid retention. Pharmacokinetic details. Half-life. The half-life of hydrochlorothiazide is approximately 5 to 15 hours, depending on individual metabolism. References: Clinical Pharmacology and Therapeutics, Book, Country, United States, Date, 2020. Study findings. Hydrochlorothiazide's role in managing hypertension and edema is well established, particularly its diuretic effects that help manage fluid retention in conditions like heart failure. British National Formulary, BNF. Website: Country, United Kingdom. Date: 2023. Study findings. The BNF provides detailed information on the side effects, drug interactions, and dosage recommendations for hydrochlorothiazide, including its use for chronic kidney disease and hypertension. Goodman and Gilman, The Pharmacological Basis of Therapeutics, Book, Country, United States, Date, 2022. Study findings. Detail the mechanism of action and pharmacodynamics of hydrochlorothiazide, emphasizing its natriuretic, sodium-excreting effects in treating hypertension. Drugs.com, website, Country, United States. Date: 2024. Study findings. Hydrochlorothiazide's pharmacokinetics are discussed here, including its oral absorption, protein binding, and the recommended dosage range for managing high blood pressure. The Merck Manual, Book, Country, United States, Date, 2021. Study findings. The Merck Manual provides a comprehensive overview of hydrochlorothiazide for various indications, including its effect on electrolytes, and the risk of hypokalemia when used for long-term therapy.